Dear ladies and gentlemen, I am Professor Valentyn Serdyuk. During the last 20 years of my practical work in the Department of Orthopedic Surgery of Odessa National Medical University, I devote my time to the problem of scoliosis and spinal pain syndrome. The reason of such an interest is based with the fact that nowadays, and even in ancient times, problem of treatment of scoliosis was actual, and it is remaining very actual, and this is why even now scoliosis is called as the tumor or malignant tumor of orthopedics. It means that there are many investigations which are devoted to the disclosure of the origin of scoliosis. And it was my luck that about 20 years ago I made a scientific discovery which was devoted to the opening of the secrets of development of scoliosis. It is based with the fact that our body has a symmetrical structure, not plain axis which you see here, but normally our spine is bended to one or another side. Such bending or deviation of pelvic to one side, tilting of pelvis, which leads to deviation of spine, is linked with asymmetry of spine, linked with the symmetry of function of hemispheres of our brain. As it was found, left hemisphere is more active than the right, and as a result we achieve spasm of muscles on one side. And in the majority of cases, about 95%, we see that there is a deviation of spine and formation of scoliosis deformation from the left side. So the idea of the treatment which I suggested is laid with the very important factor. This is the reduction of side curve thanks to usage of special shoe inlay, then thanks to rotational exercises and magnetoacoustic therapy. As a result of liquidation of muscle spasm, the spine axis become correct, and it helps the inner organs to restore its normal function. This treatment is recommended to be done from early children's age, even starting with 1 year of age, even before that age, because if we start treatment of very young children in infantile, juvenile ages, we help the body of the child to function normally, and thus we prevent development of pathologies of inner organs. So it means our method, which is based on the restoration of spine and pelvic balance, is devoted to restoration of normal biomechanics of our all tissues, and it helps the organs to function normally and thus prevents development of different pathologies of different organs in the people of grown-up age, after 30 years, even in adult and senile age patients. During the last 20 years, I have accumulated an experience of treatment of more than 8,000 patients of different ages who came to me with spinal pathology, scoliosis and spinal pain syndrome. You can investigate this method and all detailed information about its treatment in the books Scoliosis, Spinal Pain, and Asymmetry of the Body. The books may be seen from the site which is presented to you, and here also you may find a brief text about the books in Russian and English. And what I would like to add, the books are presented in the National Library, Medical Library in New York, and the Medical Library of Congress in Washington, United States of America, as well as in other major libraries of the world. Dear ladies and gentlemen, the information I presented to you and described in the books, which I talked to you about, may be a very important aspect of medical activity and medical assistance throughout the world, because there are many doctors, pediatricians, children's orthopedists who are treating patients with scoliosis and spinal pain syndrome. I am ready for cooperation with people who have an interest towards this method. And as for the ways how to organize such a cooperation, they're quite different, and you may see the proposals also in the website.